Hi guys, welcome back to my channel. For anyone new here, hello, my name is Alexis. I am a board certified dermatologist, and on this channel we talk everything hair, skin, and nails. In today's video, we're really going to focus on scaly, flaky, itchy skin and scalp. So I recently posted this video. This condition is called seborrheic dermatitis, which comes from an overgrowth of a yeast called Malassezia. Now we all have this on our skin, but when it overgrows, it produces what looks like excessive dandruff and can cause a lot of itching and flaking. Now, things you can do over the counter include T-cell gel, using a ketoconazole or a nizoral, even using a zinc type prescription. But the key is to only put it on your scalp, leave it for 5 to 10 minutes, and then rinse it out. Never put it on your hair because it can be really drying. And so many of you had questions about it. So in this video, we're really going to take a deep dive into seborrheic dermatitis, which is a medical condition. So we're going to make Mondays medical Mondays. Every Monday, I'm going to take a deep dive into the different derm conditions that you guys have questions about. Now, dermatology is anything hair, skin, and nails. So if you guys have any medical conditions that you just are curious about or that you may be dealing with and you want more information on, please let me know down below, and that will be the next video that we do on Monday. Don't worry, I will still create other content on products and skin tips and wellness, but on Mondays, I want to devote it to medicine. So if that sounds good, please give this video a thumbs up and subscribe if you are not. All right, guys, let's go ahead and take this deep dive into seborrheic dermatitis. So what is seborrheic dermatitis? Seborrheic dermatitis is an inflammatory condition of the skin that results from an overgrowth of a yeast called Malassezia. It's also known as Periodically. This is that same lovely yeast that you guys hear about causing things like tinea versicolor, which people call sunspots on the skin, so those white patches. It's the same thing that is notoriously known as fungal acne. Malassezia lives on our skin. It's actually a normal organism on the skin, but when it overgrows, it can produce flaking, itching, inflammation on the skin. So the signs and symptoms of seborrheic dermatitis can vary. At a mild state, it's just a little bit of itching and small flaking on the skin and scalp that can resemble dandruff. When it's more moderate, those flakes become larger and more apparent, and the itching can become more intense. And again, it is an inflammatory state, so you may notice some redness. On darker skin tones, you may actually notice hypopigmentation or lightening of the areas. And in severe conditions, the itching can become unbearable. Those small flakes can become thick, yellow, greasy scales. And this is going to happen in the areas where there is most sebaceous activity or the oil glands are really active. So things like the eyebrows, around the nose, behind the ears, of course on the scalp, and even the chest can be affected. So this is really something that tends to happen as our body starts to overproduce oil, and a lot of people will see it in the winter months because in the winter, as the temperature gets colder, our body actually starts to dry out in these areas, which actually sends a signal to our oil glands to produce more oil. So remember, anything that you do that dries your skin out sends a signal to your skin to produce more oil. So even the weather changes can do this too. Seborrheic dermatitis is actually a really common condition. It can affect anywhere between 15 and 20% of the population. Newborns get cradle cap as their version of seborrheic dermatitis, and then there tends to be another uptick between the ages of 30 and 60 of sebderm. Men tend to be a little bit more affected than women, and African Americans tend to be a little bit more affected than other ethnic groups. But everyone can get this, and that is why it is so important to know how to treat it. Just of note, know that if you are really stressed out, you tend to see more flares because remember, it's an inflammatory state, and stress is definitely an inflammatory state. So there's been a ton of uptick of cases because we are all living in a pandemic where the stress is real. So in this video, I'm going to give you some practical tips on how to control sebderm if this is you. Now, while seborrheic dermatitis is not preventable, you cannot cure sebderm, it is highly controllable with the right treatments for the hair and skin. So in this video, I'm going to give you lots of tips and tricks on how you can get good control and handle over the seborrheic dermatitis if this is affecting you. Also of note, a seborrheic dermatitis has been linked to several other medical conditions. So if these tips and tricks don't get things under control, I highly encourage you to seek a board-certified dermatologist so that you can make sure that there's not anything underlying causing or linked to the seborrheic dermatitis. And also, there are other treatment options that are much stronger than the over-the-counters, and you may need those to get your sebderm under control, and then you can go back to the over-the-counters once things have calmed down. Without further ado, let's get into the treatment guide for what you can do at home right now. Now, there are tons of over-the-counter options, from the Neutrogena T-Cell to the Head and Shoulders to the Selsun Blue to the Nizoral Ketoconazole. There's so many, but the tip is knowing just how to do it to make them the most effective. I have some go-tos that I clearly recommend for my patients with curly, kinky hair because we tend to need something a little different, but these tips will be applicable to everybody. The first tip I have is to make sure that you are using a shampoo with active ingredients that are clinically proven to treat dandruff or seborrheic dermatitis. So things like ketoconazole, zinc pyrethrum, selenium sulfide, tea tree oil, and salicylic acid. If you don't have one of those ingredients, my friends, you're probably not going to get very far in getting your sebderm under control. Now, once you have those couple of ingredients, make sure that you have a few on rotation, because seborrheic dermatitis is one of those aha kind of skin disorders. It gets used to a certain ingredient and that yeast starts to overgrow again. So it's important to kind of switch up your shampoos to stay on top of the yeast colonization. All right, so tip number 2, once you've found your medicated shampoo, the key is to put it only on your scalp and let it sit for 10 minutes. Don't ever put it in your hair or you're going to wake up to really dry, brittle, unmanageable hair. Just put the medicated shampoo on the scalp, dry scalp. Part the hair with like a rat tooth comb and get it only on the scalp. Let it sit for a good 10 minutes before you go to rinse it out. And if you are really concerned about your hair getting dry, you feel like you're not doing a good job of solely putting it on your scalp, then you can always coat your hair in a little protective oil before you go to rinse it out. I do not recommend you putting the oil directly on your scalp because remember, this is a yeast that already loves oil. But to protect that hair from getting dry or brittle, you may want to at least coat the ends of it while it's sitting on the dry scalp for 10 to 15 minutes. Tip number 3, go ahead and wet the hair and really work the scalp into a good massage. So you want to be massaging your scalp and not taking the shampoo and pulling it through the hair. Remember, that's going to dry you out. So take your fingers, really work them in only the scalp area, and then go and rinse it out. Tip number 4, once you rinse it out, follow up with a nice hydrating shampoo, your favorite go-to shampoo that is moisturizing. Remember, this didn't necessarily clean your hair or the ends of your hair. It just helped to get rid of the medical condition on your scalp. So follow it up with a nice moisturizing shampoo. Tip number 5, once you've rinsed out the shampoo, go ahead and apply a topical treatment. This could be a topical steroid like a hydrocortisone that you find over the counter. Scalpicin makes a really nice one that comes in a nozzle bottle, or you can even use a tea tree oil, peppermint oil, menthol, something nice and soothing that can help to relieve itch. I really like the options here. This is a Head and Shoulders Instant Smooth Scalp Elixir. And this one is the Derma-E Scalp Relief Tea Tree and Aloe. Both of these actually can stay in the hair and they can be something that you use as a maintenance in between wash days, but it's a good time to also put them on right after you have washed your hair. Tip number 6, go ahead and make sure to deep condition your hair. We want to make sure that your hair doesn't get dried out. We still need to protect the overall health of your hair strands. Deep conditioning is now a must. Please don't use any medicated conditioner right now. You've already used the medications. It's time to condition and nourish your hair. You can even wrap a nice warm towel and put a shower cap on for a nice steam effect. This method is not recommended for babies with cradle cap. Just use a baby shampoo and a little cradle cap brush for the babies. These medications are too strong for babies' sensitive skin. Most babies will actually outgrow cradle cap by the time they are 1 year old. Now, if you have the flaking on the eyebrows, around the nose, behind the ears, on the chest, you can use the milder shampoos as a face wash on these areas. Just make sure that you really wash it off twice. Do a double cleanse to make sure you've got it all off, and then follow it up with a moisturizer. Some overall tips for seborrheic dermatitis is try to avoid products that are going to over dry you. Because remember, if you're drying your skin out, it sends a signal for it to produce more oil. So things with a lot of alcohol content like hairsprays or certain gels may send the Malassezia yeast into overdrive and cause your seborrheic dermatitis to flare. So be careful about the products that you're putting on your hair. Now, if you have this on the eyelids, you may want to go with something like a nice, gentle Vanicream cleanser. You can actually use a little bit on a washcloth and use a warm compress to really help to break up the scales. Because that skin is so sensitive, you really want to be careful with what you're putting on the eyelids. You also want to make sure not to over scratch. So scratching those itchy areas, I know it provides an immediate sense of relief, but overall it can lead to infection or thickening of the skin in those areas. So please try your best not to scratch. So because these medicated shampoos that are over the counter have been proven to lose effectiveness over time, switching them out is really important. Let me show you some of the ones that I would recommend you switch out back and forth between. Head and Shoulders, of course, this is the selenium sulfide. This is the Derma E Scalp Relief, and this one is salicylic acid and tea tree oil. It's also formulated to not be drying. And then Head and Shoulders also has the zinc pyrethroione. So these are kind of the three that I would try and rotate back and forth between. Remember, my friends, this is not for your hair. It is only for your scalp. And the same goes for maintenance treatments. Certain ingredients tend to lose their effectiveness over time, so rotating them out really helps. So these are products that don't need to be washed out. This is the Head and Shoulders. This one is pyrethroione zinc, and this is the Derma E Scalp Relief Oil. This is another leave-in product. This one has tea tree and aloe, as well as an herbal blend that has been clinically proven to be effective at really helping to control the symptoms associated with seborrheic dermatitis. Now, if the flakes and the scales on the skin have just gone out of control, you may want to go with a hydrocortisone aloe blend. Urban Skin RX makes a really nice moisturizing treatment cream for these delicate areas. My friends, if these things are not working, please, please, please go see your board certified dermatologist. We are here to help you, and we have much more powerful ingredients than what you can find over the counter. I hope this video was helpful and you picked up a couple of tips and tricks along the way. Please let me know what topic you want to see covered on the next Medical Monday. Until next time, guys, be well.